I'm really excited to be here speaking with all of you today. I am Megan Chapman. I'm the Talent Acquisition Coordinator at HCRS. I started working at HCRS in 2014, and I've held a few different roles at HCRS, and since July of 2018, I've worked in human resources. HCRS is the designated community mental health agency for Windsor and Windham counties. And I would like to share my screen here and just share a little presentation and be able to give a little hands-on support in the application piece as well. So like I said, we are located in Windsor and Windham counties. We have locations from Brattleboro all the way up to Hartford, with our headquarters located in Springfield. And our mission at HCRS is to provide compassionate, collaborative, and creative services that are responsive to the needs of our community. And we do this by following 6 guiding values that really drive and shape our culture at HCRS. Those values are accountability, integrity, teamwork, balance, leadership, and growth. And just like the guiding values really drive our culture, our philosophy of care is what drives the services that we provide. It's outlined. I'm not going to go through it all right now. I'll show you where to see it on our website. But I just like to kind of highlight this document because it really shows people the beliefs that we have about the work that we do, about the beliefs that we have about the individuals who receive services at HCRS, and just what we believe about how everybody deserves to be treated. We have positions that offer many great benefits. We have multiple healthcare plans with affordable premiums, fairly low deductibles, low max out-of-pocket cost. And I like that we have different plans. So we have, you can pick a plan that really works for you and your family. We also have dental, vision, retirement benefits. HCRS will match up to 5% of the employee's contribution to their retirement. So that's really great. We have life insurance, short-term, long-term disability. I don't think I have that on the PowerPoint. I apologize. We have a really robust wellness incentive program, so you can participate in wellness activities and document that, and you receive incentive monies that you can spend toward, co-pays for medications or hospital bills or, any like flexible spending account eligible items. So, I've bought like sunscreen before, or vitamins. I know somebody bought a kayak, someone else has bought running shoes. So that's just a kind of a cool program that sort of keeps giving, because then you participate in more wellness activities and then earn, more money to put towards more wellness activities. We also have a tuition reimbursement program, winter tire subsidy, and then we have a really great employee assistance program through Invest EAP. And we also, as part of the employee assistance program, have a agency membership to Headspace, which is a meditation and mindfulness app that's really excellent as well. So I would say our benefits really focus on taking care of employees and their families, not just health, not just physical health, but also mental health, emotional health, spiritual health. So wide variety of ways that I feel like the agency really looks out for their employees. Some of our open positions, and more details can be found on the website about what each position is. It looks like I think all but one of these positions are direct service positions. So you're working with individuals who are receiving services, providing support, providing, counseling, providing de-escalation or crisis management support. So those are some of the openings. And I should also clarify that the residential specialist, direct support professional, and respite provider are also per diem positions. So we have full-time openings, and then we also have per diem openings that we are always, looking for applicants and looking to hire for. All right, so this is just a quick how to apply. I'm gonna show you quickly our homepage here. Under the About Us, you can see this is where you can look at our philosophy of care that I referenced a couple of minutes ago. That really, outlines our belief about the care that we provide. To look at our job openings, you'll click right here, job opportunities. You scroll down. These are a few of our contracted positions. So what that means is that the program managers manage the recruitment themselves. So the details, if you click here, you can see the phone number and the email address where you can contact the program development manager to talk a little bit more about the position. They actually are one of the very few roles that don't really go through me as the talent acquisition coordinator. And then to see our full list of job openings, you'll click on that little box right there. It takes you to our applicant tracking system, and you can see we have 40 opportunities currently. I think about 12 of them are per diem positions that we have open at all times. And then the other, 28 of them are, vacancies that we're looking to fill. Some of our positions you can see have a sign-on bonus. That is just, they're more difficult to fill positions. So we offer a sign-on bonus as incentive. Specifically, the clinician positions require a master's degree, so they're just harder to fill. And so we offer a sign-on bonus after 90 days of successful employment. It's just a quick look, and when you click on the position on the right-hand side, and I apologize if my little Zoom window is covering it up, you can click on the apply now, and it'll ask you to set up an account, and that's how you can apply. And once you upload your resume and you have your account set up, you can go in and you can apply for multiple positions. You don't have to upload your resume like 4 times if you're looking to apply for 4 different roles. So the hiring process, just kind of a walk through. All of the applications that come in online are reviewed by me as the talent acquisition coordinator, and candidates whose experience and education meet the minimum requirements of the role will receive an email from me asking to set up a time for a phone screening. The phone screenings, 5 to 8 questions, takes maybe 10, 15 minutes. Not a very long screening, just some kind of general information to give the managers kind of a head start. So, I'd like to know what led you to apply for the position, what experience you have that you feel like would be helpful. What are you looking for in terms of a salary, and when could you start? There are some positions that the questions are slightly different, but just those are the 4 that I think I ask for everybody. Once I do the phone screenings, I send those to the managers, ask them to take a look, and ask them to get back to me and let me know what they think. So some managers like to reach out to candidates and set up the interview themselves. Some prefer to have me help out, coordinate a time and set that up. But if a manager lets me know after looking at a candidate's phone screening and resume that they are not interested in setting up an interview, you will get an email from me that says, I heard back from the manager, they've declined to set up an interview. So I just think that's important because I don't like the idea of somebody being kind of left hanging without an answer. Then there'll be a first interview with the manager. Sometimes it's with a couple of managers if a position has like a couple layers of supervision to it, but it's not a big group. And if that interview goes well, candidates are invited back in for a second interview that will be with the rest of the team members, potentially other managers that might have interactions with, direct coordinating with this position. And sometimes if we have like a school-based position, for example, there might be a second interview or even a third interview, with the school. And then after that, if, everything is looking good, it feels like a good fit, we will conduct background and reference checks, and then we'll make an offer and hope that an applicant will accept. The offer is always based on the requirements of the job and the individual's education, experience, licensure if it's a clinical position. And so we do our best to be equitable and pay people appropriately for, their experience and their education. That's all I have for my presentation. I wanted to keep it pretty brief and be able to give opportunities for questions. So I'm going to stop sharing my screen now and turn it back over to Colleen.
Thank you.
Thank you so much.
Have a great day.
You too.